Hi, my name's Zoe Harper. I'm the National Chair for the Pain Group at the APA, and today I'm going to be talking with Helen Slater, who's a Specialist Musculoskeletal Physiotherapist, clinical researcher and professor at Curtin University. Good morning, Helen.
Good morning, Zoe. Nice to be here with you.
Helen, what are the Australian standards for health practitioner pain management education?
These standards are basically a blueprint. So health professional training outlines what people need to know, what they need to be able to do to ensure safe and quality care with a focus on pain management.
How and why were these standards developed?
This is a really important initiative that's funded by the Australian government, and it's part of the goals from the National Action Plan for Pain Management. The initiative funded the Faculty of Pain Medicine, which is part of the Australian and New Zealand College of Physiotherapists. And this is about developing a blueprint agnostic to discipline and agnostic to condition that basically trains health professionals in quality and safe pain management care.
Fantastic. And so what do physiotherapists need to know about these standards specifically?
Yes, really important that our health workforce are aware of these standards because they're the benchmark for what people living with pain should expect from safe and quality care and care that is person-centred. So as a profession, we can show leadership by being aware of the standards and looking to where we can adopt them.
Can you tell us about the online pain education network that's also known as OPEN?
Yes, so OPEN is another initiative that was funded by the Australian government. It was a 5-year program of work. And again, that related to the National Strategy and Action Plan for Pain Management. And this is all about building health workforce capacity in more coherent pain care. So again, agnostic to condition, agnostic to discipline. How can we strengthen the health workforce to support quality pain care that is person-centred? And
so how might OPEN benefit physiotherapists who are working in different fields of practice and not just pain, for example, in musculoskeletal, neurological, paediatric or pelvic health?
So what's important to understand with both the standards and OPEN, pain is cross-cutting. So it doesn't matter what discipline or area or specialty you're in, pain is part of that. So it's one of the most common reasons people seek care. And so in training efforts, that needs to cross-cut every area, every specialty to ensure there's safe and quality pain management.
What can physiotherapists expect to learn by enrolling in OPEN?
Basically, competencies and strategies to support high-quality person-centred care. People are right at the centre of how OPEN has been constructed. And to that point, we did some research with Australian people with lived experience and carers. And that helped us derive a framework that outlined what their priorities were when they seek care from health professionals for their pain management.
So what were the findings from that research you did with people with lived experience, carers and families? What were the key priorities for them?
Yes, so there were 9 priorities that were really central to quality care from the perspective of those with lived experience and carers. And those priorities included things like really effective communication, deep listening, validation of their experience, believing that it was real, respecting what people tell the health professionals they need, and not asking for things that are unreasonable, but rather saying, this is the sort of care that I'm looking for that's holistic, evidence-based and supportive self-management, which is something that is not well done. So these priorities sit at the centre of the framework that underpins the OPEN initiative, and it brings that real voice and person-centredness to the training efforts.
What do you hope that the impact of OPEN will be, given it is aimed at that multidisciplinary audience and not just physiotherapists?
One of the most important things, and this again comes through from the Australian government's National Strategic Action Plan for Pain Management, we need the health workforce to have a more coherent, consistent and quality approach to safe person-centred care. And we can't do that with fragmented training efforts that come from different directions without all singing from the same song page. So open cuts through that, and it doesn't matter what discipline, what level of training, it's consistent messaging that puts the person at the centre.
Fantastic. Thank you so much, Helen.
That's a pleasure. Thank you.